In conjunction with WEDI's Telehealth Workgroup, the collective voice of Health IT podcast is proud to present Telehealth Reflections, a conversation with prominent WEDI members sharing their experiences with telehealth, the benefits, the challenges, and what that modality meant to them then and what it will mean for them in the future. Today, I welcome Nancy Spector, Coding and HIT Advocacy Director with the American Medical Association. Nancy is also co-chair of WEDI's Telehealth Workgroup, a WEDI board member, and former WEDI chair. I'm also pleased to welcome Ed Hafner. Ed is the Associate Vice President, Payer Strategy with Change Healthcare. Ed also serves as WEDI's chair and is co-chair of its Emerging Technology Workgroup. Nancy, Ed, welcome.
Yeah, thanks,
Hi, Michael. Thanks for having us.
We're here talking about telehealth. You know, the ups and downs, the all around. Telehealth has been kind of a fixture in our lives for quite some time now. Nancy, please, ladies first, share your story regarding telehealth.
Sure. I think my story is rather simple, straightforward, and probably typical of a lot of people who have used telehealth. I started seeing a neurologist for migraines in 2020. And I went through some initial testing, met with the neurologist, went through some different testing, and then have had ongoing follow-up appointments with her. And some of it's medication management, but we have typically scheduled those follow-up visits to be in person. And then for whatever reason, I have switched those to telehealth. I think initially my first follow-up was scheduled to be telehealth because we were still in the pandemic, and it was just easier to be doing some of that follow-up for the healthcare provider, the facility where I was going, and for myself to do that virtually. And then we've had other times where I've scheduled to meet with her in the office. And the one time we had bad weather, icy roads, and instead of canceling the appointment, it was just easy to switch over to telehealth and have that touch base. And again, there was another time where I had something at work that came up, and the provider office where I go, it's about a 45-minute drive, and I just didn't have the time to get my work meeting and then get to the appointment on time. And so they were accommodating and switched it over to telehealth. It gives me an opportunity to continue to have those follow-up appointments and medication management without having to go in person every time. I know the neurologist now. We've had that established relationship, and so it's easy to do those touch base appointments. And what's also nice for me in this situation is she's part of a health system where I get all of my other care, and so all of my visits then with her and the telehealth, it all gets entered into my EHR, just like if I'd been there in person, and my primary care physician can see that information as well, and can see the medications I'm on, the testing that I had done. So I found it to be really seamless in terms of having that care, and it gives me a convenient option where I can still meet with the neurologist, feel like I'm getting that personal or up to continual follow-up on my migraine treatment without having to always go into the office.
I think it's also very important because something like migraines can be somewhat of a paralyzing type situation where you can't get outside. So I think telehealth was a kind of a godsend for you there. Real quick before I go into Ed, what was your initial thoughts of telehealth, kind of the technology before? A lot of it was face to face, and then suddenly this idea of telehealth was rushed in front of you. What were your initial thoughts of telehealth?
So, I mean, being in healthcare, I had heard about telehealth for quite a number of years now, and I just never had a real reason or, a motivator to get me to do telehealth. I've had that option at my previous healthcare facility prior to my move. But I just, like I said, I didn't have a motivator to use it. And this was really a motivation. And now that I've done it and I see the ease and convenience of it, I would definitely do this with other of my ongoing care providers. But I think I would also seek out telehealth for, an urgent care type situation if it was necessary.
Excellent. Ed, now not migraines, but just as a harrowing experience, please talk about the day you turned into Spider-Man, or I guess it failed. You did turn into Spider-Man. So go into a little bit details on that.
Or did he?
Or did you? I don't know.
That's the most disappointing part, Michael. But we were at a neighborhood block party. We're a bunch of old people, so it didn't get too crazy. And I'm sitting on a brick wall near the woods, and I felt a little pinch in my shoulder. It was kind of itchy pinch, and I tried to rub it out, and then it was okay. I didn't think anything more of it. The next morning, really early, golly, like about 5 o'clock in the morning, I had to drive north about 3.5 hours to a business meeting that was all day. And as I'm in this business meeting, it was getting really hot and uncomfortable, and it didn't feel great. Well, by the time I got to the hotel room about 8 o'clock at nighttime, I looked in the mirror and saw a baseball size, maybe a little bit bigger than baseball size, about right here between my shoulder and my chest. I was watching it closely, and it got bigger and bigger every hour. And then I started seeing a line going towards my heart. And that's when I got a little freaked out. I had another meeting early in the morning, and I didn't want, by that time, it was about 11 o'clock at night. I didn't want to wait in the emergency room for 4, 5, 6 hours because I had to wake up early. And I thought of Nancy. And I thought, my gosh, Teledoc. I have Teledoc is the service that I have. It's was promoted by our insurance company. So I called them up. Went online. I got a registration. It did take a little while to fill out the form, and I was doing it through my iPhone. And they were calling me back since the wait was about 30 minutes, and but the calls wouldn't come through. And so I found out soon enough, looking at their website, that I needed to change some settings on my phone, but I tried and it still didn't work. So after about 2 or 3 attempts, I finally went to my computer and did Teledoc from there through a video conference, much like this, Michael. And I got a doctor. He was awesome. I knew from before I just needed some antibiotics, and he gave me a comfort that I could last the evening by going to sleep and waiting until the morning to start the antibiotics, and I was treated. So I was able to go into the meeting the next morning and then drive home, still with discomfort, but knowing that I'm on my mend. So that was my experience, and I did not turn into Spider-Man.
So you say. I'll be looking at the news stories around your city to make sure there's not any crime fighting going on. I don't know exactly who it is. So yeah, when the idea of telehealth was approached to you, a very, let's say 4 years ago, 5 years ago, the idea of telehealth was still science fiction. So what were your thoughts when, thinking of experiencing healthcare from a telehealth perspective?
I had such trust with my primary care physician that typically I would just go see him to diagnose the problem. I've been with him for 30 plus years. And so I can call in if I had to get something emergency, and he would, provide, the prescription at my local pharmacy. So that was my normal thing. I think the costs of clinics, seeing the clinics have gone up, and my insurance coverage does not cover them so well. And so that was also primary, it was $30 to go have a teledoc visit, which I was very happy with. If I would have gone and seen a clinic, it'd probably be closer to 100. So that was also important factor is the economics.
Excellent. Now at WEDI, we definitely are focusing on the patient experience with a lot of the work that we do. With both of your experiences, how could it have been better, or how can telehealth from your experience be improved?
Right. Nancy, do you want to go first?
Yeah, I don't know if I have anything to offer in terms of improvement. It's the technology works well. I have that video face-to-face connection then with my provider. I feel like I get the care that I'm looking for. My questions get answered. My needs are being met. I really can't think of anything that could be better about it.
Yeah. I have two things, Michael. Make it work with my phone, right, and make it easy so that that my spam filter doesn't determine that phone number is legitimate. And I'm in technology for quite some time, and I still couldn't get that to work. The second piece is I wished I had an acknowledgement that the information was sent to my primary care physician. I just don't know if that happened or not.
Interesting. Now, I'm guessing wherever possible, you would definitely favor a telehealth visit over an in-person visit. Work schedule, the pandemic, etc. It's just a more convenient offering. Is there agreement there? I can see your head's shaking.
Yeah, I think it depends on the type of problem that you have. But if it's, say, for example, sinus infection or a spider bite or something like that, I definitely would go the telephone route.
Nancy?
Yeah, I think so. I think in my experience, I'm definitely, if it was an urgent care in an ed situation where you're out of town, and so it's you're not you accessing that telehealth gets you to care that you're going to want when you're in an area where you don't necessarily know where to go to get that. I like that idea of it. But I think for me, knowing the provider already and then scheduling the telehealth, but having that relationship is helpful because I think it would depend on the problem too. If I felt like I needed more of that hands-on physical assessment, then I would want to be in person for that type of visit. So I think it depends on the complaints that I'm having, that established relationship, and then the aspect of whether or not if I'm traveling on the road and feel I need to access that urgent care. Yeah.
Well, Nancy, as co-chair of WEDI's Telehealth Workgroup, are there things on the horizon that the workgroup is interested in looking into in terms of emerging technology, plugging Ed right there, but also from a policy perspective? Is there anything that's on the horizon that's interesting to the workgroup?
Yeah, I think that, right now we put together a fact sheet that I know it's in the approval process. Hopefully we'll get that published soon. That's talking about the end of the public health emergency, where there were a lot of waivers that were put in place by CMS for telehealth services during the public health emergency. And with that coming to an end, there's questions about what is still in effect. There was legislation that had passed that extended some of those waivers beyond just the public health emergency. So we put together a fact sheet that mimics information that CMS had put out about the waivers and the status of them, their when they're expected to end. And then we're looking to do similar to what Ed, as co-chair of the Emerging Technology Subwork Group, has been doing, is have speakers come on and talk about different issues. We think that that's going to be an interesting way to talk about a variety of topics within telehealth. And so we're looking to book some speakers to talk about anything that has to do with telehealth, whether it is the technology or the policy side of things, the patient experience. We really just want to look at all the aspects of telehealth.
Fantastic. And Ed, I know with the Emerging Technologies Group, you guys go a little deeper in the water, but there are some opportunities to talk about telehealth and that technology and how it's moving.
Yeah, with my spider bite, I had to upload a picture of my spider bite. And if you don't have that perception of where in the body and how big this is, a lot of times you put up a quarter next to it to understand how big it is, right? Being able to use, I would think using natural language processing on images would help diagnose the condition or help the physician to help diagnose the actual problems so that they can come up with a more accurate recommendation. So I think some technology could really help. Of course, communicating with the primary care physician and having ability to exchange clinical records and all of that is technology that's out there. I'm not necessarily confident that's in place yet.
All right. And fantastic conversation. This has been Telehealth Reflections on the Collective Voice of Health IT, a WEDI podcast, where the healthcare IT community connects, collaborates, and creates solutions for a better health system. Find all our episodes as well as information on our association, including the Telehealth and Emerging Technology Workgroups, on our website, wedi.org. Thank you for joining us, and be safe.